Hey everyone, it's low carb and keto nutrition specialist Amy Berger bringing you the one and only keto without the crazy. Let's talk a little bit about ketones today, shall we? From time to time, I get an email from someone and it goes something like, I'm not losing weight. What should my ketone level be? Or I've been doing keto for X amount of time, my blood sugar is still high, what should my ketone level be? Or I'm doing keto, my ketone level is only 0 point blank, what should it be? I don't know. What should it be? Because asking what your ketone level should be is really the wrong question. And I don't love saying it that way. It's not a wrong question. You're not wrong to wonder, but it's not the question that will be helpful for you. I think a better way to say it is, am I doing the things I need to do in order to get the result I want? And I have notes again, which is good because it hopefully helps me stay on track and I don't leave out anything critical. So it's not so much what does my ketone level need to be in order for X outcome to be achieved, but really, what actions do I need to take or possibly stop taking in order to get the results I want? And this may surprise some of you, especially if you're new. If you're new to the ketogenic diet or the keto realm, that you can get great results without ever registering high ketones, however we might define high. I know people who have lost north of 80 pounds, north of 100 pounds, who never really registered ketones of 2.0, 2.5, 3.0, they were kind of in the 0 point something range, 1.2, 1 point some low decimal number. And so depending on what you're trying to accomplish, your goal is not to have a high ketone level or a certain, to meet a certain threshold of ketone. Your goal is to get the result you want. Whether that is losing body fat, reversing your type 2 diabetes, reversing your PCOS, reversing your fatty liver, getting rid of migraines, clearing up your skin, getting rid of joint pain, all the wonderful things that we know that keto is good for. And so many of those, if not all of them, can be accomplished without high ketones. Most of the results that we are going for on a keto diet are the result of lower blood sugar and lower insulin, and also just less inflammation, right? Of having a fat-based metabolism, of using fatty acids and ketones, mostly fatty acids though, as our main fuel source, rather than relying primarily on carbohydrate as our main fuel source. And so it really, what has the biggest impact on whether or not your ketone level matters is what you are trying to accomplish. Again, for things like weight loss, improving your blood sugar, improving your blood pressure, helping to normalize hormones and PCOS and all of these like other sort of metabolic health things, most people don't really need to have high ketones. They just, the ketones, one sec, I'll come back to that. For other goals, for other purposes for which more and more people are beginning to adopt a keto diet, the ketones might matter more. We don't know yet. This research is really in its infancy. And I'm thinking mainly of the psychiatric conditions that keto is now being shown to be really effective for. Maybe not for everyone, but for a lot of people. Things like major depression, anxiety, bipolar disorder, schizophrenia, traumatic, well, this isn't psychiatric, but a traumatic brain injury, so like neurological issues, traumatic brain injury, Parkinson's disease, Alzheimer's disease, multiple sclerosis. There's some really promising research on this. Now, is keto a slam dunk cure? No, but the research is really promising. And for reasons I can't get into in this video today, for those particular applications, the psychiatric conditions and the neurological conditions, your ketone level might play a much bigger role in you feeling better compared to someone whose main goal is weight loss or better blood sugar and all that. And so I do have a video, actually I have a very long video on Alzheimer's specifically, and I have another one on ketogenic diets for neurological and neurodegenerative disorders, that those do go into detail as to why the ketones are probably more important in those specific situations. I will link to them in the notes for your convenience in case you're interested in those specific topics. But the point is, depending on what you are aiming for with keto, your ketones might matter a lot, or they might not really matter at all. So let me consult my notes here, because the notes always matter. Okay, so when I said I would come back, I said the ketones are, no, I'll come back. Let's come back. Ketones are the result of breaking down fat, not the cause. So it is not the case that, oh, if I could just get my ketones to 2.6 or 3.4, then I would lose weight. Then fat would melt off of me. No. When you are breaking down more fat, your ketone level will be higher. So again, the ketones are the result of metabolizing a lot of fat. They are not the cause. So I have a long blog post from back when I was blogging way back in the day, where I explained the difference between burning fat and having a fat-based metabolism and using fat as your main fuel versus being in ketosis, versus generating high ketones, because they are not the same. And we know they're not the same because if you are following a very, very low carbohydrate diet, a ketogenic diet, and your carbohydrate intake is really, really low, and you don't have very elevated ketones, well, how does that make sense, right? Well, you have to be burning fat. You have to be, regardless of your ketone level. Your body has to be metabolizing fat because there's so little carbohydrate coming in, and yet you're still alive. You're functioning, your brain is working, your muscles are moving. That's all being powered by something, and it's probably not a ton of glucose. It's going to be a little bit of glucose, but it's mostly fat. And for reasons that I explain in that blog post that I'll link to about the difference between burning fat versus being in ketosis and producing ketones, you can absolutely be breaking down fat even if you don't have high ketones. So again, it's not, the question isn't really what does my ketone level need to be or what should my ketone level be in order to accomplish X goal. It's, is X goal being accomplished by the actions I'm taking? Is what I'm doing getting me the result I want? And if it's not, the ketone level might or might not have anything to do with that. Okay. Something else that I think is important to cover here is that there is still a lot we don't know about measuring ketones. It's really only within, honestly, the last few years that we have so many more people doing a ketogenic diet, and that we have access to these blood meters for ketones and the breath meters. And the urine strips, the urine ketone test strips have been around for several decades, but the blood meters and the breath meters are kind of new. Or, you know, you might have been able to measure that 20, 30 years ago, 40 years ago in a study. And it probably cost thousands of dollars to do it. It's only really recently that you could buy a ketone meter off the internet, you know. And by the way, if you want a ketone meter off the internet, I do like Keto MOJO. I know the owners of the company personally. I think they have hearts of gold. They do a lot of charity work in research and in the keto world. They give away a lot of meters for research purposes. If you're looking for a keto meter, do check out the Keto MOJO. And so there's just, it's only recently that we have so many more people measuring that we can gather so much more data to start making sense of all this. But And please know, I am speculating here. I'm thinking out loud. I'm sharing my thought process with you. But some of this thought process was inspired by my friend Dave Feldman, who some of you know from his research, the fascinating research he's doing with cholesterol. And let's see, I'm not sure when this video will air. I will link to some of his stuff in the notes. Dave Feldman, he has a documentary coming out. I'm not sure when it's going to be available worldwide. They're doing the premiere, the world premiere at the CoSci conference in Las Vegas, February 7th through the 9th, 2025. I have to say the year in case anyone finds this video way in the future, if YouTube is still a thing. And so I will be speaking at the CoSci conference, CoSci Collaborative Science Initiative. I'll put a link below. Anyway, I'm sure most of you watching this channel are probably familiar with the name Dave Feldman. But we do not like to have high levels of blood glucose, right? Because that tells us, well, my cells are not taking it in. My cells must be so full of glucose or fat or something already that they're like, nope, we don't need any of that energy. Like, that's what glucose in the blood is, right? It's an energy source. You can convert glucose to energy inside your cells. So it's traveling in the blood. It's an energy source that's just sort of traveling in the blood, looking for a place to go. And we don't like having high blood glucose because we think that's a problem. And same thing with triglycerides. Triglycerides are a storage form of fat. It's 3 fatty acid molecules bound to a glycerol molecule. You don't need to know that. That's the boring, or to me, fascinating biochemistry part of it. But anyway, triglycerides are a storage form of fat. And by that's also how they travel in your blood. That's why you can get a blood triglyceride level measured. We also don't like having high triglycerides. That's a sign that you're eating way too much carbohydrate or drinking a little too much alcohol. Again, that's just energy backing up in the bloodstream. If you have high blood sugar or high triglycerides, you've got this glut of energy backing up in your bloodstream. And we generally consider that to not be a good thing. Why is there so much energy just in my bloodstream and it's not getting into places that can use it? So why do we think that having a high ketone level is desirable? And I'm not saying it's not, please, I am speculating here. This is just me thinking. Why? And ketones are also an energy source. We convert ketones into energy inside the mitochondria in the cells. So if we don't like a lot of glucose backing up in the bloodstream, we don't like a lot of triglycerides backing up in the bloodstream, why are we aiming to have a lot of ketones backing up in the bloodstream? It's just yet another energy molecule. And if it's getting to a high, not acidosis high, not ketoacidosis high, but 3 millimolar, 4 millimolar, whatever. And I'm not saying that we shouldn't aim for that. Again, depending on your goal, depending on what you're using keto for, you might need to do that. But what we measure in the blood, when you take a blood ketone measurement, you are measuring what is inside your bloodstream at that moment in time. You are not measuring how many ketones my cells are using, how much of my overall energy usage picture is being made up of ketones, because we don't really have a way to measure that. Thank goodness, frankly, because what we need is more crazy in the keto, right? Please no and thank you. But I mean, I'm just saying you have to have an appreciation for this little bit of nuance. When you take that blood measurement, that is measuring what's in the blood, what's in transit at that point in time. You're not measuring what's going into your cells. And so you could almost frame it like, why would I want my ketones to be kind of on the high side? I don't want them building up in my bloodstream. I want them easily and quickly getting into my cells. I want them nourishing my neurons. You'll find out why in the Alzheimer's and neurodegenerative condition videos. I want them going through my muscle cells. I want them going to my heart, to my cardiac muscle. So, but again, I am speculating. I'm not saying that it's bad to have high ketones. Again, not the acidosis threshold, like a safe, a physiologically normal level of ketones. I'm not saying it's bad. I'm just saying we don't need to automatically aim to have it high and think that that's going to magically fix whatever we are trying to fix. We just don't know. We don't know yet if higher is automatically better for any one particular condition. Again, we could just as easily wonder why my ketone level is high. Why are my ketones 3.0? Why are they 4.0? Why is it building up in the bloodstream in my cells? I mean, I would rather have a 1.5, a 1.0, if that means that my cells are taking these ketones up just as quickly as my liver is putting them out. If that happens, if the rate of uptake in your cells is sort of matched to the rate of your liver's producing them and secreting them, then it's not going to get to a high level because your cells are, you know what I mean? The give and take is sort of a wash. But again, this is all speculative. I am absolutely not saying that no one should aim for high ketones or that high ketones are bad or not helpful. I think they absolutely can be depending on the context. But I just don't want some of you out there worrying that you're doing something wrong or that keto's not working or that you need to go through heroic measures and jump through 86 hoops in order to reach some arbitrary ketone threshold level that may or may not have any impact on you getting to where you want to go. Again, for weight loss, for diabetes, for most of those metabolic syndrome, insulin resistance type things, I think the ketone level really doesn't matter that much. So what matters more, your ketone level or whether you are doing the things you need to do to get the outcome you want? There's a lot more nuance in all this than is typically appreciated and then is typically taught to you or shared with you by various and sundry influencers out there. And they're kind of doing you a disservice when they just spout out these little sound bites they make for good clickbait, they make for good thumbnails, but they distort the science or they oversimplify it to the point of being inaccurate. I'm all for simplification. Keto without the crazy, keto without the overcomplication, keto without the I need a PhD to even understand this video. No, we like simplicity, but we don't want to make things so simplified that they're actually wrong or misleading. And was it Einstein or Edison? Somebody, I think it was Einstein. And I'm going to butcher the quote, but it goes something like, things should be made as simple as they can be, but not simpler. Meaning, like, let's simplify this as best we can, but not make it so simple that it's just nonsensical anymore. So just to recap, there's a lot we don't understand yet. It's really fascinating to follow the research and see what's going on and look at the discoveries that are being made. But there's just a lot we still don't know. And there's a lot of nuance. There's a lot of gray area. There's a lot of, here's one of my very favorite words, context. So much of what is appropriate or effective or important depends on the context. And in the context of a keto diet, the context is, what is your goal? What are you setting out to do? Okay. If you are setting out to do something with the keto diet and you need help, if you're confused, if you're overwhelmed, if you don't know what to make of anything anymore, and you would like someone to help you get the crazy out of your keto, I think you came to the right place. I am available for one-on-one individual consultations. I also have a Patreon. I have a whole group where you can interact with me live at least once a week. Depending on the tier, you might have 2 live calls a week. Q&A, chit-chat, discussion, topics of interest. That's available to you. So check out the Patreon. Check out a one-on-one call if you're interested. I work with people all over the world. So if you're outside the US, don't let that stop you. I can accommodate somebody's time zone. We'll find a way. And let me just recap. Okay. So to close out, the best question, the appropriate question, is not what should my ketone level be. The most constructive, helpful question is, how do I get the result I want? What do I need to do, or what might I need to stop doing to get the result I want? And that may or may not have any relation to your ketone level. All right, definitely check out that blog post. If I just blew your mind, or you kind of don't know what to make of anything anymore because you thought ketones were the most important thing and you've been chasing your ketone level like crazy, and now you just heard, what? I can be burning fat without having ketones? Like, yes, check out that blog post. There's links to everything in the notes. There's also a link to the beloved Keto Without the Crazy merch store. Just a reminder, we've got, mugs, tote bags, sweatshirts, t-shirts, all that good stuff, so you can share the love. Share the Keto Without the Crazy love with the world. And until next time, keep the crazy out of your keto. Thanks for watching.